evening and welcome. I hope you can tell all your friends and family, everybody. Bring moving vans, come anytime when we have these things because it's really nice to be a part of the community for sure. So thanks again. And so tonight my topic obviously is my specialty. I'm a physician assistant and I've been doing this specialty for about 10 years now. I do believe in specializing in one thing because you get really good at it. So with that said, I mainly handed out like kind of an overview of what I wanted to talk about because there are some understandings that need to be, I guess, understood. I'm kind of repeating myself. Not very good at speaking, but here I go. So with that, I handed out this outline. I don't know if everybody got one, but did you get one?
I did.
Do you want to share? So the interesting thing is you'll see on the front there's a picture, and when you see them side by side you kind of almost think, well, what is that all about? But basically what it is a way to understand how much damage we're really getting over the years of aging. Aging is pretty much why people come see me predominantly. My population of patients varies. It can go from young adolescents who are dealing with a little bit of acne all the way up to where you start getting into a lot of the age management issues. So with that said, when you see this picture, you go, if you don't really look at what's below and you look at the differences, you know, the one on the left has not had any sun really at all. So obviously this Tibetan monk years without being in the sun. You could see that he really didn't take a toll of aging as much as the patient on the right, who's only 58 years old and spent all the years in the sun. So that can be separated into this understanding of intrinsically we have a genetic makeup. We all come to the table with a set of cards, whether we're Irish or whether we're Native American. And that kind of tells us how we're going to age, aside from how much sun we've gotten. So, you know, they can break it down. They say, well, that's intrinsic. You know, that's kind of what you're born with. And that's what I think separates the understanding of somebody who does aesthetics really has to know who's in their chair. You know, what is your genetic background? And then once you figure out, okay, your heritage is, you know, you're Northern European or whatever it is, you're going to go through the process differently. And I'll get into more of those details in a minute. And then obviously extrinsically means what has the sun done to us and what is all the free radicals and stress and possibly smoking or medications, diabetes, all these other things are outside factors that will contribute to early aging. Even dentistry has a big role in my work. So I'm going to kind of talk a little bit about both of those things so you kind of get an understanding why I say when patients come in and they find out the differences between the two, they go, well, I just basically want the combo platter. You know, I want the sun damage to be gone, and I also want to address some of this breakdown that I'm having because of my genetics. So I'll kind of go over those things with you and start from there. So the first part really is there's 5 types of skin. There's types 1 through 5. And when you look at the types of skins, 1s and 2s are fair-skinned. You know, they're Northern European, blue-eyed, blonde hair. We burn easy, we get sun damage easy. And then you get into the 3s that are more Ellen's type. This is my wonderful patient. And we'll talk about that later because this is actually her first time doing anything. So bravo and kudos to her for being courageous enough to be my model. So, so 3s are more where you start to get into a little bit of olive skin. You start to have like the eye color gets a little more hazel and brown and etc. Now you get into type 4s who are Native Americans, Pacific Islanders, the Asian descent, and then 5s obviously are African American. So when you look at genetically what cards you've been dealt, it will kind of give you an idea of how you're going to go through the process. So if you get a lot of sun and you're types 3, 4, and 5, you're really not going to get too much of the the sun damage issues because you're evolutionary, you know, your cells are able to cope. So usually the patients who are 3, 4, and 5 have pigmentation issues if they've had too much sun. And then their skin sort of gets very lax as they get older and they lose volume. They don't necessarily get all of the sun spots, the broken capillaries, the brown spots that types 1 and 2 get. And the reason why I bring that up is I separate the treatment plan basically into 2 categories. I go, how much sun damage have you had? What type of skin are you? And that dictates like what kind of laser treatments will I be recommending. So a lot of times my patients are types 1 and 2, Northern Europeans, we'll just say that. They do need a combination of the laser treatments to get that sun damage off. And it really does work great. And if a patient decides they want to, let's say they come in, they're either mild, moderate, or severe. If they're moderate, they may need a series of 3 to really get 10, 15, 20 years of damage off. And the laser that I choose is, it's basically like a Porsche, except we can't drive it, but it works really good. And the reason why I chose this one, I've been working with it for a very long time, is it's very friendly. Meaning, I can get in there and make a huge difference, but you're not going to have to worry about missing work the next day. Or having everybody ask you, wow, what did you do, you know, to your skin? And, or get you to where if you have a treatment, now you're going to get a complication from it. Maybe you're going to have a result of, you know, just a loss of pigment, which happens with some of the higher end lasers. So this one has basically 3 ways they can improve the skin, and that's why I have on the handout, it's called the 3 T's. So you got tone, texture, and tightening issues as we're going through the sun damage aging process. So I'm just going to talk about the laser for a little bit because a lot of times people, they hear lasers or they'll see like an offering in the magazines and they think, oh, I don't know about that, you know, it's just going to be scary or I don't want any downtime. But the 3 treatments that I have, one that I have is really friendly. It's a photofacial, and I'm sure, who's heard of photofacial? Yeah. So what that does is it's basically a way to get off color problems. So now we're in that first T, which is called tone. And you're dealing with skin tone. What is the color of your skin? Do you have a lot of broken capillaries around your nose area and the cheeks and the chin? Or do you have a lot of accumulated brown spots from the sun and the damage in the body trying to compensate? So that light is, I mean, I don't have the handpiece out here, but I can grab it, but it's basically a handpiece like this, and on the end of it is like a camera flash of light. So it's basically 2 inches by 1 inch, and in this camera flash of light has ability to talk to the skin and what's going on underneath and what's present. So if you look at light therapy and the spectrum of light, you have all the different colors of the rainbow. This particular handpiece is isolating broken capillaries and brown spots. Now, if I had a light and I have a patient who has jaundice, I could put a black light on there, put, you know, whatever patient has jaundice, and it will pull it right out of the skin. That's why the babies are under the UV black light in the NICU, because they have jaundice and the broken down cells of red blood cells are in the body skin, and it's a way to just pull it right out. So light does talk to the skin. And if I could show you in here, in this room, you would think that's a tanning bed and it's counteracting what I'm doing, but it's not a tanning bed. It's actually red light. So red light was really studied, people who were in submarines and people who were going into outer space, they were really having poor wound healing. And they thought, how can we figure out a way to get this improved, because they're in such conditions for such long periods of time, and if they get hurt, they're not going to heal well. Well, they discovered red light therapy actually stimulates collagen and cuts healing time down remarkably. So I figured the room's empty, I'll have a nice red bed. So patients can come in, and it's actually very healing and healthy. So they can go in, and it runs for 20-minute sessions. It heats up a little bit, very comfortably. And you don't come out feeling like, uh-oh, I smell burnt skin or anything. You actually feel better. Your skin is more hydrated, and it increases the circulation in your capillary bed so that you heal better. So that's just another example of light therapy in and of itself. Hi there. Oh, nice to meet you. Have a seat. Nice to meet you, Tom. This is Al's husband.
Sorry, too.
You can tell by the way she lit up.
Julie.
Nice to meet you.
Nice to meet you.
Yeah. So that in and of itself, the photofacial would be something I usually recommend for most patients because, you know, you have these issues in the skin and when you actually apply that flashlight, per se, I used to use that as layman terms, but it's actually really highly concentrated light. It goes into the light waves, it goes into the skin in the deeper layers and it wakes it up. It says, you guys have been sleeping and hanging out in the slow lane. I need you to kind of move into the fast lane and turn over. Then it also tricks the body into thinking, wow, we have something going on there. I better send more collagen. I better send some repair cells. And then, luckily, because of the filter in the handpiece, it goes, oh, I'm going to target you, you capillary, and I'm going to target you, you brown spot. And it absorbs the heat of the light because of the filter in there. And those issues are gone a week later. So if you got somebody who comes in and they got brown spots or capillaries or whatever, you just do one treatment over it with the light and you don't have any side effects. Other than, let's say you had a brown spot here, I could go ahead and do the light therapy over the brown spot. The only thing you'll see as a side effect is the brown spot will look a little darker until it actually comes up to the surface and it's off a week later. So a lot of times you go, oh, I got all these spots and all this sun damage, and there's a couple really good pictures in there, and I'll pass it around to where you could see the before and after of just what the IPL does. Chris, you want to grab it? It's that top one, yeah, that one right there. And I'll put it to the page where you can see what exactly a light treatment does. It's pretty impressive. Like even just the hands. That's what light therapy will do. A week later, all these spots are really gone. And then the chest. This is a young patient, basically, probably just in her like 40s. And she's got all these accumulated spots. You go over that one time, and it'll definitely look like that a week later. That's why these are so popular, because they talk to the skin, they say, you guys need to turn over, you've been sleeping, and then let's get the issues off at the same time. So, and then there's no side effects at all. You don't peel, you don't flake, you don't even come out pink at all, for that matter. So, I'm pretty certain you guys probably have a good understanding of that. So when you see photofacial or IPL, you'll know what it is. So then the next treatment of the laser that I like to do is this guy right here. As a sharpshooter, this would be my favorite gun for sure, because I have different tips that I can attach to this, and I can customize what I'm dealing with. The patient comes in with a lot of texture issues. Let's say I have a patient who has acne scars, or they have a lot of like crepiness under the eye, or they have fine lines, or any kind of texture issue. This is your best friend. So what this does, instead of taking out the person, they go into an esthetician, they get a chemical peel to kind of improve their texture. You're basically almost doing a chemical burn over the top layer of the skin. And if you do those a lot over time, your epidermis will get a lot thinner. And the studies have shown that. So what they've discovered over all these years of refining all these laser treatments is we need to disrupt the skin, but we don't want to compromise the person or the patient. So it's very friendly for all these skin types. So it doesn't matter what patient I have in the chair, this one is very friendly. If I do a treatment like that, it's not going to trigger them to develop more pigment because they got a treatment. You know, sometimes there's a population that, you know, the patients who get melasma or anything like that, if they get a chemical peel, they will worsen their melasma. So it's very friendly, and that's the only reason why I brought it up in that regard, is because anybody can get it. So the important thing about that is, if you have a texture issue and you have all these fine lines all in through here, you go, well, how can I change the texture? Well, if I fire it one time, it'll distribute a square like this. And let's say what's hooked up right now is a 9x9 square, 9mm. So inside the square, we'll have 81 microbeams that go whoop right into the skin. And if here's your top layer and all your layers are underneath, It's a beam that goes down to the middle layer, and it's a disruption, and it's microscopic. So the body again goes, oh, I got trauma. Let's send a bunch of cells and repair. And so here they come, and within 12 to 24 hours, that beam space is full of new cells to repair. So, and because you kept healthy cells all around it, they start to remodel and integrate, and you've improved the integrity of your skin. And that's a way you can really do a nice job with the texture issues of your skin, and also tell it you need to grow new cells. One of the little paragraphs I have in the handout talks about when we go through menopause. And literally when we start menopause or even peri, we lose 30% of our collagen in our skin, collagen and elastin. They're basically fibers in our skin, just like our garment is held together by all these little threads. Our skin is the exact same thing. So if you're really in menopause and you start going every year, you're going to lose at least 2% every year following. So if you kind of say, I want to keep some signal going and I want to develop new cells, this is a way to do it. You can just once or twice a year just do a light treatment, and you're going to see a nice difference and a nice kind of nice way to go through the process of aging, you know, and even creating more new cell growth without any downtime. Most of the time when I do patients, I'll do a full face, neck, chest, a lot of times tops of the hands, and then if I see areas, you know, that need concentrated areas, like sometimes in and around the mouth, you'll see what's called elastosis. And that basically is when your texture is so damaged from all the years of radiation that it looks like feeling like an orange peel, kind of on the surface. That's when you've lost elastin in your skin. And this is a way you can get in there and put new cell growth back into that layer and get rid of some of that elastosis. So this is our best friend. When I do a treatment, let's say someone comes in and they have both. They have the sunspots and then they, of course, have texture issues. I mean, we all do. I do both at once. So I do the first treatment, I do the color issues, and then I follow it up with a pixel. And then if you have a real area that needs to be concentrated on, like let's say crepey neck or anything, I'll attach a higher end tip and it'll really get in there and tighten the skin. So that's where the third T comes in, is tightening. I also have another handpiece that's a near infrared tightening modality, and I can get in there, and there's a picture, or it was like the first one that I had up there, that shows you the difference when I tighten a series of 6. I can get in there, and the infrared light, what it's doing is targeting collagen in the skin that's there. And when that light targets it, it makes them coil up, like we throw our clothes in the dryer and we take them out and we go, oh no, we shrunk it. It's a good thing. So that is another way to kind of just improve the elasticity issues of the skin. So I try to keep it simple so patients can really understand the 3 T's, and then you'll see the laser 360, because I have 3 different treatments, and sometimes if I get somebody who's moderate or severe, I can do like a 360 in 60 days. So 3 treatments in 60 days, and that's why I call it 360. So, and then keep in mind it's super friendly. You're not going to miss work. Nobody's going to really know you're going through anything until like a couple weeks later they're like, wow, who are you going to? And that's how I got popular. So, with that said, you know, that's mainly just kind of an overview quickly of the lasers and what it's good for. And then pricing is, it varies. A lot of times if patients do need 3, then I like to kind of set up more of a package for them so that they get a discount on each treatment. And then also, if it were to be an individual treatment, like for example, when I do both treatments at once, like I talked about, it's $395. So it just kind of gives you an idea of the cost for that, for one treatment. So then the other issue that I'll talk about is my fun side. And I love this side because this is where you get that instant gratification. And when you're my personality, you want it like right today. And it's hard to kind of go, okay, you're going to see a difference in a week and those spots will be gone, because I want to follow them around and watch the spots fall off. That's me. So the other side I do is more injection based, and a lot of people have a lot of fear about this category. because they don't really understand the products, and they don't understand the development of them and how they're used. And there's a lot of examples, like our new celebrity Caitlyn, and all these things. So we get this idea like, oh my gosh, if I even consider that, I'm just gonna not look the same. And that's not me as a provider. I do not like to change who I have in my chair, other than that process of softening the process. So when patients are usually between 40 and 60, they have this period of where they have volume loss in their face. So really, there's not a lot going on as far as needing surgeries or any of those things, unless you're genetically maybe have an extra heavy eyelids or something. That's the exception. But in the process of 40 to 60, we're going to lose volume in our face. Bottom line, everybody will. And it depends on your heritage where you're losing it. So my goal is, when I have you in the chair, and like in Alan's case, we talked at length this week, and then she had, of course, obviously the reservations that I would understand and respect. So she decides, I really am not liking what I'm seeing at this point. Is there anything I could do without doing anything invasive, like seeing a plastic surgeon? Yes, absolutely. So I think it's important when we're talking about Ellen in particular, because she's gone through this stage without really having any kind of maintenance done. So like, let's say I get somebody who's maybe in their early 40s and they're losing a little bit of weight, maybe, or it just depends. They lose a little bit of fat in their face. This is where I can say, let's kind of come in and keep the integrity going in that area of the skin where you lost it. And then over all these years, you won't really need anything drastic down the road. You won't need anything. Kind of really keep up what's going on. So when I have a patient, we'll talk about those things. And then we'll also talk about if a genetic expression is really contributing to an area of wrinkles. So that's when Botox comes into the picture. Botox has been around since the 40s. It was developed for cerebral palsy patients because they were having all these spastic muscle contractions. They were in a lot of pain, and they needed to come up with something different, because the only remedy at the time was, let's give them muscle relaxers, and the kids were completely out of it. So they said, okay, well, let's develop this product so we can actually relax the muscle without affecting the patient. And that's how the research development came with Botox. And I like to add that all these years, 40 years now, or longer, well longer, that there hasn't been any complication that I've seen with Botox all these years at all. So it's basically just a protein molecule that's removed from botulism toxin A that causes the muscle to relax and paralyze. That protein molecule is taken away and is destroyed, but it still has the ability to be like a magnetic shield over the muscle. So in this case, if I say, Ellen's got some muscles here that really are making these deep frown lines, my job is to say, okay, well, let's treat you a little bit like here and here and here where those muscles are located. And if you do one little injection, and it goes about maybe a centimeter around the muscle, and it coats it like a magnetic shield. So when the nerve comes to go in and hit that muscle and say contract, it can't quite get through that molecule. And then eventually it just kind of dissipates and dissolves and goes away. It doesn't go into your brain. It doesn't do anything crazy. So with that, that's how Botox works. So when I get a patient in there and maybe they are interested in Botox, in Ellen's case she's not, and I have definitely a handful of people who are not candidates, or they don't want to be, and I really respect it. I don't ever try to push it. But it does make a difference. I can kind of come in and go, okay, you've been squinting your whole life, and this lateral brow is a little heavy, so sometimes I can come to this muscle and just pop it right out like that, and you get that immediate result, and it lasts for about 3 to 4 months, and then you can come in and get retreated. What I find a lot of times, if patients really have that genetic expression frown line, when they do get a little bit treated there, it actually relieves a lot of tension that they carry. A lot of times people carry stress right here. And it does make a difference, the way they feel too. So, and now it's being used for migraines. It's being used for a lot of different things going on. And I'll introduce Moz too, because It's, his last name is a wonderful name, but I always have a hard time saying it, so.
It's easy. Hashish, hashisha.
Hashisha.
Like hashish, people like to smoke hashish, right?
Okay. I call him Dr. Maz, and I love calling
Dr.
him
Oz.
that. I say Maz. His first name's Mazen, so
Yeah,
I always say Dr. Mazen. He hasn't corrected me, so I stick with it.
That's fine.
Yeah, but he's a cardiovascular surgeon that I work with, and then he also works at another office that I'm associated with that has general surgeon and colorectal surgeon, and also
Breast.
Kim Grafton, who does breast cancer, and she does the mastectomies and everything. So at some point, I'm hoping they'll come and do a little talk. Dr. Maz is going to do his at some point soon, and he does leg veins, so I'm looking forward to that. But also in that office, they could treat like incontinence for the bladder with Botox. So there's a lot of really good applications for it, not just for aesthetics and not vanity, you know. So now what I want to get into mainly is the talk about volume loss in the face and where people lose fat. And that's where I come in as more of an artist, including my medical background. So like in Ellen's case, when we're looking at where she's lost, she just has her loss rated through here mainly over all the years. So with that said, everybody loses it through here. Almost everybody when they get to that, they'll have a deficiency right through here. This tissue right here is a muscle. That's why it never goes deficient, because it'll always stay this thickness because of the muscle underneath. Adjacent to this muscle in this section here, they call it cuppet lines or marionette lines, or in and around the mouth. There's that fat layer underneath the skin is just gone. It's just thin. So she just has that top layer of her skin, and then underneath there's really not much of a mattress anymore of fat to keep the contouring from this part into her chin. And so it creates a lot of shadowing. So when you're taking pictures and you're down the road and you're like, it looks like I'm really sad, you know, and that's kind of where patients will come in and say, you know, can I do something about this? So the product that I favor is it's called Juvederm, and it's the family in the Allergan family. So Allergan has the product Botox, we all know, but then they also have this section of skin's fillers, they call them, and they're basically the sisters of Juvederm. What's in Juvederm is high hyaluronic acid. So that is a building block that we have in our synovial fluids in our joints. They're using, I call it HA for short. Even in the equestrian world, they give horses injections now of HA so that they can get back out in the arena, and it really makes a difference for their joints. So it definitely is a strong building block, but it's also very friendly, and it doesn't react to the skin. They don't take it from anybody else. They aesthetically make it, but it's nice because if that skin has lost its integrity or it's lost that layer, I can come in as an artist, go in, deposit as I leave, go in, deposit as I leave. Now I can create a correction of the area that's deficient. And that's where the magic comes in, because sometimes people who are not fans of Botox and they have creases, I can come in with that little bit of filler and you can instantly see the difference. So once that's there, you know, essentially your wrinkle is down here and it's like a V space, and then the skin is down here, which is creating this wrinkle product in there, and it starts to bind to the surrounding cells and it gets reinforced, and now you got this beautiful soft difference that's corrected. My motto is if somebody comes in for the first time, I like to do a real conservative treatment. I like to just kind of get in there to get them introduced to seeing the difference, feeling comfortable with it, and then going, oh, a week later, I love it. You know, I'm ready to do more, and that's even if you've missed 10, 20 years of not doing anything. So I like kind of improving things and keeping them natural, and I call it health maintenance. I think it's kind of a way where we can just feel better about ourselves. A lot of times we don't get to pay any attention to ourselves as women because we're so busy taking care of the kids and the husband and doing our jobs that a lot of times if there's a disruption and that's all radically changed, we look in the mirror and we go, oh my gosh, I don't know if I'm going to be able to really go through life looking like this in the mirror. So they can come in and I can soften it a little bit and help them out, and it really helps the way they feel. So now I kind of pretty much got through a lot of the talk that I wanted to go over, and just a little bit of an understanding why I call it the combo platter. 'cause you could do lasers and you can also do a little bit of this instant stuff. So I just wanted to see if there were any questions real quick before I show you a demonstration. So is there, anybody have anything they want to ask? Sure.
Do any of these things make permanent changes?
No, they don't. Except the lasers.
The lasers
Yeah,
do?
the lasers are, you know, they do go in and in a fractional way, they definitely make a nice permanent correction. But, you know, you're still gonna go through that next year where you accumulate more sun or you have a little more aging going on, so it's always good to maybe check in once a year. Sometimes if you did a series of 3 and now you're free to roam the country, a lot of times patients will come in to keep that signal going. But yeah, it definitely, for the laser base and whatnot, it stays, yeah. And even like in this case, you know, when we do a little of the Juvederm and I'm gonna come in these areas to correct some of this deficiency, that'll last a whole year in that area. It doesn't like go away that easily. And even in a year's time, if she decides to come back and to get a little bit more, some of that's still gonna be there, and we'll just correct some of the areas that it changed again, or keep up on it, or something like that, so it's that friendly too. Anybody else? Oh, sure.
What are the long-term effects of this that you're injecting? Where does it go? How does it dissipate or not dissipate?
Yeah.
What happens to it?
It
in
actually,
your body?
once you have it in that section, in that layer, it gets reinforced with the body, just like the high hyaluronic acid is in your synovial fluid. And eventually, it just starts to break down in such a slow, insidious process that it really doesn't go into your bloodstream. It really just doesn't go anywhere. It just disappears, just like as if you had an excess of lactic acid because you went to the gym or you did something where your body just eliminates different things and breaks it down and gets rid of it. It's that in that regard, no process.
Has this been studied over more than
It has.
a few years?
Oh, yes. Like, this product alone came out in '07, and you know, Restylane was the first one out there that was high hyaluronic acid based. And they were onto the right idea, except for they just didn't have it refined and perfected. Because you would absolutely be able to go in and correct certain lines, but it would hit and miss, and then if you squirted it out on a piece of paper, you would see it was very broken. It wasn't very smooth and consistent, and all the molecules were perfectly made. When Juvederm came out in '07, it basically kicked Restylane to the curb because it was perfectly made. And then it went through all the studies, FDA approved. Out of all the years I've been doing this for 10 years straight, Juvederm has not given me one complication, where I used to see it a little bit with Restylane. Restylane high hyaluronic acid concentration, I thought, was a little bit too strong, so it would sting a little bit more. Not only that, sometimes I would see maybe a little irritated area of the skin because it just didn't like that concentration. With Juvederm, there's no evidence at all. I mean, even after the fact, the most we could ever run into is maybe underneath. Obviously, we have little veins that run through here. Sometimes they run in and above the lip. They're very tiny, but sometimes if I go in and deposit, I could hit a little vein. You could get a little bruise that might be about this big. It usually absorbs and resolves within 5 days, and the patient, you know, doesn't have any other complication. And that's another aspect too about who you go to when you decide to get this done, because it is good to go to somebody who has that strong medical background. You know, a lot of times you can have different day spas and stuff like that, and they just might not have all that, you know, to really make sure you're in good hands. Plus, you have to be an artist with this product. I mean, I'm just going to say that bottom line. If you can learn, and I've been in training sessions where people get that basic training, but you have to say, I have this person in my chair, and this is how their deficiency present. This is how I'm going to go in. This is how I'm going to avoid veins. This is how I'm going to keep them out of trouble, basically. So, do you have any other questions? I mean, I know you had more concerns probably than anyone. Is your wife?
Well, more or less the long-term effects. I mean, this has been out for 7 years. That's really not a very long time
Yeah.
to have.
But it went through like
a
20 years of study
history.
before that, yeah. And the other product that was the sister was out in '96. So it's been out for a lot longer than that. And now it's just, you know, HAs are so friendly and they're basically taking over everything. Even topicals now. A lot of topical creams have HA in it because it's a building block. It gets in there and it's like your skin's a dry sponge and it's lacking. And it's almost as if you gave that sponge water. It kind of expands out and it's really happy.
And why does it only last for, let's say, a year?
It's just because of the size of the molecules to get it through this tiny little needle, the area, and then there's always just this simple like process of breaking down, you know, anything for that matter. So, okay. Well, I'm definitely gonna start, so I'll just talk about like, you know, when I have a patient and they come in and I do kind of an overview, it's very thorough. I talk about like, you know, if there's any history of any medical problems, or, you know, I like to know if the patient ever even smoked before, or they have diabetes, or they have any issues, because it kind of gives me an overview of their baseline health and how well they'll do. So, and then also address the sun damage issue too. But she's been really good, Ellen has, because she's pretty much stayed out of the sun. The sun got her here though. So just the direction that it hits, it hit her chest. And luckily she always wore a hat and wore sunscreen and really stayed out of the sun. So you could see like the difference, right, just alone. So, so that's the sun damage we talked about quite a bit. And then I understood that she just not a fan of Botox, which I'm definitely okay with. So we talked about just ways that we can help some of these areas that are a little deeper right through here. So I'm going to use Juvederm. I'm going to treat her, and you guys can all watch. You don't have to sit in your chair. You can come up and be closer. You can actually see, and then you'll kind of know in your mind's eye, oh, this isn't that bad. And it's not like it's extremely painful, or it's not like watching surgery or anything like that. But if you have any where you don't like that kind of thing, then please let me know, because I don't have to put Moz to work to kind of bring you back to life. Anyway, so hold on, keep going here. But yeah, you're welcome to come up.
So you're gonna do half, so
Yeah,
that you
so-
can see the comparison.
Let me put your feet up.
Thank you.
So that's what I'll do at first, is just kind of show you how I'm going to approach the areas that she needs corrected. Let's see, magic. Yeah. So obviously, I know it's hard. It's going to be hard for her to be serious. Okay. So I'm going to start lower. I'm going to do this line right through here. Then I'll do a little bit here, and then here's where she has a lot of the area that needs to kind of be corrected. So I'll come from this way and come in this way and just do some fanning in through here. And then once I'm done on this side, I'll let you guys come up so you could see how one side's so much better than the other. And you can see how fine this is. And the technique and everything, so. I had placed some numbing cream on her earlier, so I'm pretty certain she's pretty
Pretty nice.
I do that, it's just basically a topical lidocaine, and it also helps constrict the vessels so that you don't have easy bruising or anything like that.
I get so smart.
Oh, okay. So with, when the product itself comes in a sterile container, it's like your own syringe. So everything is sealed, you don't have to worry about anything. So it basically looks like this. You guys can pass it around so you can see. So I'm gonna start out low and slow. I'm only doing a little. I just want her to get used to it and, you know, and just be comfortable with it. So I'm just gonna start on this side and then I'll go to the other side. It's almost like being a magician.
Yeah. Do your magic.
I'm trying to hide from everybody, really.
Yes, you are.
I know. I think I should have.
Where am I? Chair.
Thank you.
right where you're in my workspace. I don't have my electric chair in the other room. but this one. And you'll see, because I like to have my person in my workspace, that I'll kind of be doing like a yoga warrior stance.
So don't smile.
Yeah, you just want
Be
to be
serious.
relaxed for a second. I use a very tiny needle. It's almost the size of an acupuncture. I don't like to use big needles. I find that you get a better result this way. I mean, if I was doing, like, let's say somebody came in, they were really hollow, I might, use a different technique to put in volume if they really needed it a different way, but we won't go into that. So, in this area, I'm gonna start this lower area, so this is where I'll have you kind of open like this. So I just kind of go underneath the skin, deposit as I leave. And you can already see, like, it's gonna make a big difference. Is it comfortable?
Yeah, it's fine.
I mean, you can see she's not grimacing, she doesn't seem like she's in a lot of pain or
I
anything
feel a
like
little
that.
stiff, but it's nothing.
Yeah. A little higher. You can come up, Tom, if you want. So basically, I did a little of this smile line and then through here. A little bit more right here. See, when you use a tiny needle too, you don't get a lot of the bleeding or anything like that. It's very small.
Still more in that syringe?
Yep, we're almost done. Watch that smile. I know it's hard because you're super sharp.
Yeah.
Can you get it a little bit? Perfect. It looks great. You can look at it. So, she did really great. Like, she didn't have any bruises at all with the treatment. I could tell, usually when I'm working, if I kind of know that a bruise will be there, I could kind of tell by I'll get a little bit of a flash. She didn't at all. She might have these little red dots just from the tiny little needle. Those are usually gone by 2 or 3 hours later, even especially the next day. So if a patient's gonna usually get anything like that, they'll know it already before they leave, and then we can say, okay, just put a little ice on it. The little bruise will be there for 5 days, and just kind of, you could wear makeup right away. The needle size is so small that as soon as I leave, that skin closes right up. So there's really no risk for infection. So, I mean, those are just, that's how easy it is, and it's very friendly.